Hello, I'm Bertha, and this is week 7 presentation. I'm going to be talking about um, doing a liver, abdomen, and pelvis scan. So, the first thing I'm going to do is demagnetize, and I'm going to go into zone 4 and set up for the type of exam that I'll be doing. So, this is what I'll do for each type of exam and MRI uh, scanning. And so what I'm going to do first is I'm going to put on some gloves. And so I'm going to sanitize the scanning room, wiping down the scanning bed, the coils, the emergency squeeze ball, and the headphones. And then I'm also going to select the type of coil I'm going to use for the exam and have everything set aside, and then place some fresh linen on the scanning bed, as well making sure it's already leveled down for the patient. Then I'm going to walk out of the scanning room and close the door behind me. Then I'm going to look at my inquisition to make sure that the patient's first and last name is there, date of birth, and the order of the type of exam I'm going to be doing is there, as well as the doctor's information and signature. Once I do that, then I'm going to call my patient from the waiting room by first and last name. And then when I go into zone 2, I am going to confirm their information and screen them to make sure that they don't have a pacemaker or anything like, um, what do you call it? Artificial heart valve, defibrillator, things like that. So after going over their screening, I'm going to have them change out of their street clothes. And then once I do that, I am going to walk them over to the scanning room and again make sure I'm demagnetized. I'm going to walk in the scanning room with them, and then for the first type of exam I'll be doing is for the liver abdomen. And for that one, I'm going to have the patient lie down supine head first. And the type of coil I'm going to use is the type of coil I'm going to use is the phase array or torso coil. And when I place it on them, I'm going to make sure that the coil is underneath their armpits. I'm going to have them put their arms over their head. And then I am going to put their earphones on, hand them the emergency ball, and let's see. Then I'm going to landmark the laser to the xiphoid process, which is right under here. I'm going to let the patient know that there's going to be some breathing instructions, and if they're by any chance they're feeling like they can't keep up, to let me know. They can squeeze the ball, and then I can assist them with that. Then I'm gonna walk out of the scanning room, shut the door behind me, and then gonna set up my angulations, my slice angulations. So once in the control room, I'm gonna set up my localizers to make sure that my images are set up accordingly with the axial, sagittal, and coronal. So for the axial-free breathing sequence, I am going to basically cover from the dome of the liver through the inferior liver or kidney, depending on the site. And the field of view should include the entire abdomen and soft tissues. So it's just going to be a full view of the anatomy, like straight for the axial. For the coronal breathe hold sequence, the field of view is going to be either the dome of the liver um, and the kidneys, or it could be through the iliac crest to the pelvis. And for the axial breathe hold sequence, again, it's going to be from the dome of the liver, top to bottom, and it's going to be just a straight coverage of the anatomy of the soft tissue of the abdomen. When all pre-contrast scans are done, I'm going to inform my patient that I'm going to inject them with the contrast so they can anticipate, that going in them. I'm going to also let them know that if any time they're feeling any type of discomfort or emergency to squeeze the emergency ball, and I'll go in to assist them. And as I'm injecting them with the contrast, I'll begin to start to see it going through them. And as soon as the contrast goes through the aorta, the pulmonary arteries and aorta, I can begin the multi-phase axial sequence. Once the contrast has gone through, I'm also going to check with the patient, see how they're doing, how they're feeling, just to make sure that they're okay. Now for a general pelvis MRI scan, I am going to have the patient lie down supine feet first on the scanning bed, and then I'm going to use the phased array abdomen pelvis coil. The patient's arms are going to be placed on their side. I'm going to hand the patient their hearing headphones. Headphones cover their ears, and the emergency squeeze ball. And then I'm going to use the laser landmark, and it's going to be on their mid pelvis. Once the patient is set up, I'm going to ask them if they're okay, and then I'm going to walk out of the scanning room, shut the door behind me, and then I'm going to go to my control room and set up my scouts for the coronal, sagittal, and axial. For the axial sequence planning, so for the axial sequence planning, I'm going to cover from the iliac crest to the iliac crest through the pelvis and just get the full anatomy of the axial. The coronal sequence planning is going to be angle between the hip joints to try to create a true coronal. Sagittal sequence planning is angle between the hip joints to try to create a true sagittal. Once I'm done running my scans and sequences, when I'm finished, I am going to take the patient out of the scanning room and just tell them thank you for coming in and just help them get out of the scanning bed. And yeah, that's about it.